The effects of traditional medication can sometimes be parallel because of the placebo effect. Within this presentation, we will go over what exactly this effect is, the types of studies that utilize it, how contextual effects aid in its effectiveness, and apply to cardiology. Inactive treatments are termed placebos. They are meant to promote desired physiological outcomes by altering one's psychological outlook. One study, by Wager et al. From 2004, demonstrates this psychological effect. Patients who were unaware they took a placebo for lessening pain showed this outcome did in fact occur. This is evident as locations in the brain responsible for pain seem to have lessened in activity levels after these patients took their placebos. These results show a correlation between the effects of placebos and traditional medication options. Randomized clinical trials often utilize placebos. Patients are randomly delegated to different groups in these studies. Moreover, double-blind experiments also use them. The experimental group refers to the individuals who are taking the medication being tested. The control group does not receive said medication. Instead, they receive a placebo which is not meant to have any effect. These experiments may be double-blind since neither the researcher nor the participants know which group has the real medication. Contextual variables play a large role in promoting a placebo's effect. The degree to which the effect is affected was assessed in a 2021 study by this individual and colleagues. Contextual variables are environmental factors. For example, the way researchers treat their participants counts as a contextual factor. Depending on this treatment, a participant may present different responses to a placebo. Expectations also fall under this umbrella as they promote an optimistic outlook. Participants are more likely to feel improved conditions if these are their expectations going into the study. The study mentioned previously analyzed 186 trials and concluded that 54% of overall treatment effects came from contextual effects. Overall treatment effects group the response of participants to the medication being tested and contextual effects. The 54% metric represents the large role contextual variables have on a participant's response. They even played a slightly greater role when compared to the effect of the medication being tested. Placebo effects have been identified in cardiological studies. They are difficult to see in this type of research, as psychologically treating cardiovascular irregularities sounds rather difficult and abstract. Nevertheless, Sheldon and Opie Moran published a review article in 2017 that outlined the role placebos played in several studies that pertain to cardiology. The most significant results were that 34% of participants in a study by Sohaib et al. In 2013 experienced similar outcomes of those of individuals who underwent cardiac resynchronization therapy. This type of therapy regulates the heart beating rhythm. 34% of participants is a significant amount considering the intricacies involved with this treatment. Apart from this finding, a general trend exemplified that placebos were able to reduce anxiety and stress levels in participants. And these are my references. Thank you.